Welcome, postgraduates. I would like you people to diagnose the condition on the screen and explain to the extent of a university short question. In fact, I got this idea when I went through the question papers. This was a university question for us. What do you see in this? What are the points that you people see? And then just jot them down. Diagnosis is not mandatory, but your observation is. So it is an Azzopardi effect, which is a histomorphological feature. There is an incrustation of the blood vessel wall with a basophilic material. Incrustation means it is getting deposited into the blood vessel wall. And the blood vessels close to a tumor develop this kind of a feature. There can be areas of necrosis that are seen. We'll be seeing again pictures like that. Earlier picture also showed it. And it was described by Azzopardi in 1959. And it is probably the degeneration of the DNA or sometimes the RNA and can be mistaken for calcium deposit. That is why one of my other presentations will be on calcium. He examined many cases of the lung cancer, particularly the small cell carcinoma, and found nearly 32% of the cases positive for it. Normally, it occurs in tumors with a high cell turnover. This is what we see. So, the granules are negative for staining with calcium, but is positive for von Cosa and alizarin red. We had seen this in another class also. And it is positive for a fuel-gen reaction in which there is a basophilic material of DNA. Nuclear extraction can be done for confirmation, and you find large amount of nuclear material in this. H&E shows hematoxyphilic material, and there can be necrosis in the background. Merkel cell carcinoma, small cell carcinoma, for that matter, any tumor with a high cell turnover can have this. And this is a gentleman, Dr. Azzopardi. So you find that this is history over here, and then he found it specifically in diagnostic surgical pathology of the breast. Thanks to Wikipedia for this source. This is a beautiful schematic picture which you people should draw and explain. I find that in a small cell carcinoma, numerous nuclei which are closely packed are over here. And then whenever there is a high cell turnover, please do remember that there will be tumor necrosis. So there has been necrosis, and all the necrotic basophilic material have been deposited in the vessel wall. Incrustation. Supposing it goes out, I will call it as excrustation. So this is called the Azzopardi phenomenon. So there can be the nuclear material, sometimes anti-nuclear antibodies can be formed, and then you get a hematoxylin body, which is called the fuel-gen effect, positive for PAS diastase. This is a wonderful reference for it, thanks to J. Chan. And the number of cases being studied. This picture is quite beautiful. This is a vascular lumen showing the RBCs, and the vessel wall is showing 40 areas of basophilic material throughout. It's clear? And it is associated with tumor necrosis. The other points have been mentioned. Thanks to National Library of Medicine for this. The Azzopardi effect. I would like you people to describe this. So, obviously, it is highly cellular. Whenever I say highly cellular, I should see the proximity between the adjacent cells. And I find that there is hardly any cytoplasm, which means they are all nuclei. High cellular turnover and small cells because of the proximity of the nuclei. There can be smudging, so you do not find the details. Molding can be there because of rapid division and redivision. Incrustation can be there, and deposition is incrustation. Granular material can be seen. Look at this again. The Azzopardi phenomenon, you find that there is a kind of necrosis over here, fragmentation of the cells, and infestation is there. Courtesy Facebook. And I would like you people to describe it. Beautifully, it shows the degeneration of the tumor cells because it is highly proliferative, and the eosinophilic one is a necrosis in the background without any cellular detail, and the deposition in the vessel wall. This is from Neuroendocrine Tumor, Journal of Clinical Pathology. Thank you.